maximum of $15,000, for instance. Is that right? 25,000 per incident. Um, Jason, you want to comment any more on that? Would that
Yeah,
be fair game?
I'll go ahead, Mike. Yeah, the basically how it works is that when it goes to court, you may have a settlement agreement already entered into. Again, before I say that, all of our enforcement activities are closely monitored. We work with EPA enforcement so we make sure that we meet the requirements of the program. The maximum penalty is $25,000 a day per violation, but sometimes courts will mitigate that down. So when you go to court, it's not the preferred place to go. You would prefer to go ahead and get everything that you need. The money is a deterrent. The most important thing is getting the control in. If there's a control need or an action change or a work practice change or some of the stories he was telling you about, that's what's the most important. But if you go to court sometimes, a lot of times, the court has a different opinion because things happen depending on who's the judge, and politics plays into it sometimes too. And so what we want, what the community wants, may not come out of that type of litigation or court action. So the preferred method is usually trying to go ahead and get something agreed upon. So when it goes to court, it's settled upon, a settlement agreement, consent decree, and it's already done. But if there's a lot of pull, we will pull back and sue and go to court. But there's no guarantee when you go to court. I mean, it's depending on who's the judge.
All right, and then I guess as a follow-up question to that, how much would the Jefferson County Department of Health typically spend of that money? How much are you spending to go into these litigations?
There's some cases that cost hundreds of thousands of dollars, way more than the penalty amount.
Do y'all by any chance have the authority to increase that maximum penalty?
We do not have the authority.
My second question is, does Jefferson County Department of Health have the authority to change the standards for how much pollution is allowed to be admitted into the air?
Yeah, we technically could potentially do that, but basically we depend on the EPA to do the research and the science and the policy making, and then we follow that because a great deal of resources go into doing all of that to come up with a good policy. And so we as a smaller health department really don't have the resources to do that. So we generally depend on the EPA to set the policy, and then our job is to follow what the EPA and then ADEM does.
I completely understand and respect that. So I guess as a follow-up question to that, the EPA has completed new studies recently, and due to the results of that data, they've been vouching for new and more stringent air pollution regulations. Has Jefferson County Department of Health ever considered using that data and passing those standards for the county that currently the U.S. Congress is neglected to pass?
That's an interesting question. I don't believe we specifically have done that, but we are hopeful that we will have some new regulations coming soon that will, we can just go in line with that.
If that doesn't come, will you look into taking that action?
That's an interesting question. I think we could consider that if we have the science to back it up.
Okay. Well, hopefully, if that doesn't get passed, the EPA can use that data already collected and pass your way. So I know y'all are in great contact, so I'll let y'all deal with that part. But has there been any studies going on by, I guess you could also ask, this could also be a question for the EPA, but has there been any studies going on by the Jefferson County Department of Health to find out how the pollutants in North Birmingham may be traveling to other areas of Birmingham, and what potential effects these pollutants could be having on at-risk groups in these areas, such as patients with cystic fibrosis in Southside?
Any of our air pollution engineers want to comment on the dispersion issue and the general ambient air?
We haven't really studied the pollution migration per se. Obviously, there could be pollution migration depending on current air currents and other meteorological stances. But as far as what was the second question?
Is that being looked into as a study of how it is traveling and what kind of effects it would have on at-risk patients?
We haven't per se studied that at the local level.
Has that been done federally, that you know of, or by ADA, that you know of?
No, um, basically, we have not done any, air dispersion models, to my knowledge, in the Birmingham area, but I will go back and just make sure that that answer is correct, but to my knowledge, we have not.
I would greatly appreciate
I
it.
guess one comment I would make about that is that we're still waiting on the air toxics data just for North Birmingham. So I would see that as a first step to see how much of an issue that is, because then the second question may not be an issue. You know, and if it is, then that might be the next step.
Fair. So, is there anything, I mean, obviously y'all just talked about apparently one study that y'all are looking into. But I guess I feel like I've just brought up multiple things already that could be done. And currently they're not, for whatever reasons, haven't found that out. So I guess I was curious, what else are y'all doing? And as the director, particularly the director of Jefferson County Department of Health, don't you think the #1 environmental injustice community in the entire nation should be a huge red flag? And why is it not a red flag right now?
I'm sorry, what are you asking about as far as a huge issue?
Why, in North Birmingham, what's going on? I feel like that is the #1 environmental injustice community in the entire nation. It should be a huge red flag. And why is it currently not a bigger priority, a bigger red flag?
Well, I mean, it obviously is a priority in terms of the studies that are currently going on. The health department is looking into some of the health concerns. We are still waiting on the report from the Agency for Toxic Substances Disease Registry, ATSDR, which is doing a fairly extensive study to look at a risk assessment, to put all the data together to find out what the actual risk is. We had heard that would come out several months ago, and we're still waiting, but it should be very soon. So that's going to be very, very important. At the health department, we've also been looking at, in the meantime, trying to gather what other data that we can. And I can just sort of brief you on what we've learned so far. We have looked at death certificates for North Birmingham area, the 3 neighborhoods that we've been talking about. And because we own all the death certificates, and compared those to the rest of the county, matching for race, sex, and age. And they're, based on those death certificates, there is no increased death rate in North Birmingham compared to other areas. Now, one caveat to that is that generally when we're looking for increased risk related to pollution, we're talking about a chance of 1 person in a population of 10,000 as being sort of the threshold for where it's unacceptable. And the population of that area is around 9,000. So the death certificate information is reassuring. We know at least it's not way off the chart, and we have no evidence that there is an excess death rate, but there is a little caveat there. I would also say that just because there's no excess deaths doesn't mean there's not a problem. Because death, you don't want death to be your main endpoint. You want to be concerned as well about morbidity or disease. So that's where we really need a lot more data. We have looked at our own clinic data because we have 6 different clinics around town, over 200,000 visits. A lot of that is pediatrics, the majority of that is pediatrics. So we have looked at our own data for children from our own electronic medical records, and looking at asthma in particular. And again, we don't see an excess rate of asthma in North Birmingham compared to other areas. In looking at the death certificate information, we also looked at subsets, things that we might be concerned about, like lung disease, death from lung disease, death from cancer, death from heart disease. Again, we don't see any differences from one area of town to another when you match, when you control for other demographics. what we clearly see is what we already know, and that's disparities in terms of race. And that is one of the biggest things that we are focusing on in the health department is multiple efforts to reduce disparities in health. And that comes from all sorts of angles. Some of them I mentioned in my talk, some of them I didn't, but through a lot of the partnerships I mentioned, we're taking a multimodal approach to get at those disparities. We talked about asthma, and we talked the fact that asthma rates are actually going up while pollution levels are going down. But one thing we do know is that if we breastfeed babies, their rate of asthma goes down. The rate of a lot of other illnesses goes down. Obesity rate goes down. So that's a big emphasis for us, is to try to encourage breastfeeding. That's just one example. Food deserts, getting more fresh foods, vegetables into low-income neighborhoods where they're not available. The work we've done in tobacco, the list goes on. So that's a big, big concern in decreasing those disparities. Just a little bit more about North Birmingham. We have been working with the Alabama Department of Health, which keeps track of all reportable diseases. And asthma is now a reportable disease. It has been for the last few years. I think maybe last 3 years. Is that right, Brent? Somebody? Anyway, just for a little while. And unfortunately, right now, the data that they have is only county specific. So we can compare Jefferson County's asthma rate to other counties, but we don't have data that's narrowed down more than that. But in talking with them, we are hopeful that perhaps in the sometime within the next year, we may be able to get some data that narrows it down by zip code, and that will be very, very helpful, so that we can compare one neighborhood to another. And since asthma is an epidemic across all urban areas and across the country, that's something that I'm very interested in looking at, so that if we see pockets of asthma, we can really focus on some interventions to really help those kids that have asthma. We have some pediatricians that have been doing some cutting-edge work on helping children with asthma control their asthma, including modifying the home environment, things like that. Trying to remember if there's something else I can update you on. Oh yeah, there was a concern raised about birth defects. I went up and listened to Lois Gibbs when she came to town, and spoke about the history of her experience at Love Canal and the origin of the Superfund. And she had mentioned birth defects. We have looked at our birth certificate records, which do list whether there's birth defects or not. And we again looked at different areas of town, compared North Birmingham to other areas, and again, we don't see any excess birth defects in that area. So we have some reassuring data, but again, I'm very quick to say that we would really like a lot more data. We need more data. And really, the thing that I feel is going to give us the biggest bang for our buck in the short term, because gathering really good quality data by us doing it sort of the hard way will take a long time. So we really are very interested in this ATSDR risk assessment, taking all the data and putting it together and say, what is the likelihood? So if you want to look at arsenic levels in the soil, okay, what about those arsenic levels? What is the risk, from the data we have and the best science we have, of actual disease in this community related to those arsenic levels? So that information is going to be very, very helpful. And I think we're all waiting very anxiously for that. And we're all a little frustrated that it's taking so long. But hopefully that will be soon. We did design questionnaires for adults. We've done a few of those to look at a number of things that we would anticipate you might be concerned about in North Birmingham, and we're continuing to do those. And we just recently developed a questionnaire for the children, and a couple of our pediatricians are championing that cause. But that's going to be, it's going to take a while. It's a lot of work to get enough questionnaires done to have meaningful data, and you'll also have to have a control group. So we'd still have a lot of work ahead of us on that, but we do hope to gather some data that could be helpful, especially if after these other reports come out, we still have some unanswered questions. At least we're a little bit ahead of the game with, you know, another way of getting at it and finding out what's going on.
So I guess the first question I have is, are those studies published, and have they ever been peer reviewed?
I'm sorry, what studies on?
You just said you looked into studies such as comparing birth certificates, death certificates.
Yeah, no, that's just our own data, our own epidemiologists, just checking our own data to make sure, just to see if there's a problem.
So there's no official, you've never officially looked into it, and there's
published.
nothing that's public?
We have not published those. I'm getting together some data to present to the community, and this is information that I have shared with some of the community leaders as we've gone along. Okay, but these are not academic papers. These are just us looking at our data to see if there's a problem there.
If you
Okay.
look under the Joint Superfund program that's run by EPA and NIEHS, which is now over 30 years old, there are a number of other communities that have chronic exposures to arsenic, that have exposures to toxic organics, etc. There is a body of literature out there that is not hard to find if you're interested. And so, while I don't know it per se, I would think that a little work in the library should yield plenty of information that at least could be relative toward trying to answer the questions that you're posing.
That's why I was just
Anything else from
curious.
panelists you want to comment on that? I'm sorry. Okay, any other, yes, ma'am.